as parents, infant feeding, all of that. Okay, let's see. What are some of our questions? Let me get my moderator to open up this chat for me. I'm going to text him right now and see. Okay. Okay, here we go. Open the chat. Okay. It's funny because we have moderators and I keep thinking, it's a long day for you and it's a long day for me. But for them that are just sitting there with no pregnancy, they're not pregnant, they're just watching. Sometimes it can get a little bit boring for them. Okay, here we go. Thank you so much for opening on that chat. Okay, so okay, Christina, really good question from Christina. When would you use a nipple guard or a nipple shield? So if your baby sometimes is having a hard time latching, maybe your nipples are a little bit smaller or they're inverted, right? You have flat nipples. They're not very easy for the baby to catch and bring into the mouth. A lactation consultant or a nurse might say to you, why don't we try nipple shield? And all a nipple shield is a very thin silicone device that goes right over your own nipple, but has a little bit of a thicker sort of fake nipple, right? So it goes right over your nipple, and it's very flimsy. It's easy for the baby to latch onto, but it goes flush up against your skin, and the baby sometimes makes it a little easier for the baby to latch onto that. But the process is the same because the milk will still be released through the baby's sucking. So it's a really great option if moms are having trouble with breastfeeding. Okay. Kenny says, I'm planning to breastfeed. Because of my 2-month maternity leave, my baby will have to get bottled breast milk when I'm at work. When should I start giving her bottles? Great question. In order to get her used to it. Does it create nipple confusion? Okay. So I think that nipple confusion actually depends on the baby. I had 4 children and I was just like you. I had to go back to work relatively soon after having my babies. And 3 of my babies took to the bottle with no issues whatsoever. And I started after about 4 weeks. So I would do exclusive breastfeeding for 4 weeks. And then after 4 weeks, I started introducing a bottle with express breast milk just to get the baby used to it. 3 of my 4 kids had no issues with it whatsoever. My 4th, my daughter, she would not take a bottle. No way, no how. She only wanted to breastfeed. So that was a little bit of a struggle. So for her, I had to make accommodations. I had to breastfeed her as soon as I left. I had to take like an hour of personal time. I had to go home at lunchtime, feed. I would leave, go back to work. I would come home right after work and feed again. And in the meantime, she was miserable, would not take a bottle, no way, no how. So, for some babies, they just won't take a bottle, and you gotta kind of keep at it. Eventually, my daughter took a bottle, but when she was little and I had to go back, she didn't care. She would just nurse and she would wait until I got back home to breastfeed. So it does depend on the baby. I think it's really a great idea in that case if you're going to switch to bottles at some point to get baby used to sucking something other than your nipple. A pacifier is a great way. You can do that right from the first day that they're born. I don't believe that pacifiers cause nipple confusion, and that's after doing this for 30 years with 4 babies. There are people that will tell you 100% it creates nipple confusions, but babies have a very distinct instinct and need to suck. So whether they're sucking their hands or sucking a pacifier, sucking a bottle, sucking your nipple, they want to suck. So I think that if you're going to, do a combination of breast and bottle feeding, 3 to 4 weeks after they're born is a good time to start introducing nipples. And you might have to try lots of different nipples to find one that they like, because it does go in their mouth a little differently. Okay, how often does feeding occur? So with breastfeeding, we said that you want to breastfeed every 2 to 2.5 hours. With bottle feeding in the beginning, it's usually 3 to 3.5 hours. Once the baby hits about 6 weeks old, that period of time stretches out. For bottle feeding, 3 to 4 hours. For breastfeeding, about 3 to 3.5 hours after about the first 6 weeks. Okay, Michelle, do you and baby get the same benefits of breastfeeding if you choose to exclusively pump? So that's a great question. And the answer is yes. If you are expressing your breast milk on the same schedule that you would be nursing a baby for the first 6 months, you do have the same benefits of, decreased risk for breast cancer, ovarian cancer, all of that. Decreased risk of obesity also with babies if you breastfeed, whether you pump or you breastfeed, the mechanism is the same. So yes, you get the same benefits. Your baby still gets the same benefit of maternal antibody transfer. So that's a great question. Thank you for that. Okay. Aisha, does C-section cause challenges with breastfeeding shortly after delivery? So listen, I hear that all the time, Aisha, and I would tell you that I don't buy it. I don't. I think that, if breastfeeding is initiated after that first hour, and that is sometimes a mother's choice, not the staff in the hospital. If you can initiate breastfeeding within the first hour, I think that C-section isn't going to interfere with your ability to breastfeed. But what happens is sometimes moms are really tired and then they have, they've been in labor for a long time. They end up with a C-section and like they just say, I have no energy, which I totally understand. I can't breastfeed. I'm so tired. That's when breastfeeding can be delayed and it can be a little bit problematic. So, as tired as you might feel, I would say if you can get even one breastfeeding session, even if you're exhausted, tired, trying to get the baby to the breast within the first hour or two after delivery, it's going to make it easier down the road for you. So, I think that's an excellent question. Okay, what if I have an inverted nipple? So, Brittany, no worries. We talked about that nipple shield earlier. Your nurses in the hospital or birth center or your midwife or maternity care provider is going to be able to help you. A lactation consultant might be necessary to sort of show you other ways to sort of, pull that nipple out a little bit or use a nipple shield to help you to breastfeed. So you can absolutely still breastfeed. It's a little bit more challenging, but it is doable even if you have inverted nipples. Do you wake up for feeding every 2 to 2.5 hours? Yeah, Chelsea, you kind of do. This is what I advise my new moms. I say if you're very consistent, right, during the day about feeding that baby every 2 to 2.5 hours, then the length of time that you can go at night, can be a little bit longer. In the first 4 weeks, you can actually stretch it out, to maybe every 4 hours at night. Now, again, it depends on what the baby's birth weight is. If baby needs to gain weight, you're going to have to get up every 2 to 2.5 hours. You're probably not going to have to get up. The baby will get up for you, right? We'll be crying. But if you're really consistent about nursing the baby every 2 to 2.5 hours, right, then you can stretch it out a little bit at night. You want to discuss that with your pediatrician. But if you follow some of the advice that our parents give us, never wake a sleeping baby, and you're not feeding consistently every 2 to 2.5 hours, baby's got to make that up at some point, right? When does that happen? It generally happens at night. So I usually tell moms be really good if you're breastfeeding every 2 to 2.5 hours for the first 4 to 6 weeks. Then you can start stretching those feeding times at night. And then once the baby here's the best part about breastfeeding, really hard in the beginning because you feel like you're constantly feeding. But once you get to about 6, 7, 8 weeks, somewhere between that 6 week and 8 week time frame, babies become so efficient at feeding that I'm not kidding. No joke. Take notes. It becomes like 5 minutes, and then they're good for like 3 to 3.5 hours. That happens right around the 2 month mark. And then you are smooth sailing all the way for as long as you want to breastfeed. They become so efficient. It really is 5 to 6 minutes, boom, they're good. They're good for several hours. So that's the best part of breastfeeding. The hardest part about breastfeeding is not the first week, which is what you're here. It's not the first 2 weeks. It is really the first 6 weeks. I promise you, if you hang in, then the benefit comes between that 6 and 8 week time frame. If you're choosing to bottle feed, it is in the beginning your baby will sleep a little bit longer because the formula is so dense. So, great question. Okay, do you need to wash, then sanitize bottles and parts, or just sanitize? You want to wash them out really well and then sanitize. Okay, Teresa, what's a regular schedule for newborn sleep and eat? Okay, so generally, I always talk about this book in my baby care classes. It's something, take notes, it's a good book. There's a great book called On Becoming Baby Wise. It's a really easy read. The name of the author is Gary Ezzo, EZZO, Robert Bucknin, those two. So Gary Ezzo and Robert Bucknin. It's actually a whole series on becoming baby wise, child wise, teenage wise. Some of the greatest advice I got was through that entire series. I had heard about that book from patients long before I had my own kids. It's been around forever. It actually talks about parent directed feeding after the 4 week mark. So, demand feeding is you feed whenever the baby's hungry, and that's pretty consistent for all of the sort of books that are out there for the first 4 weeks. And then the styles kind of change a little bit. But I had heard about that book, and everybody called it like the sleep Bible. And I followed the principles in that book with some flexibility. And I had 4 children that were sleeping through the night from 9 weeks on. I'm not talking sleeping like 6 hours through the night. I'm talking sleeping 12 hours through the night, 6 p.m. till 6 a.m. I would say it was luck if it happened with one of my kids, but it happened with all 4 of my kids. Take notes on becoming baby wise. Greatest book I've ever read. I get no money from that company for saying that. I am just telling you, it was literally the easiest to follow and the most practical information. And it really, the strategies in that book, if you follow it, it worked for me 4 times. And thousands and thousands and thousands of patients had told me about it. Okay, so regular sleep schedule. Babies generally wake to feed. That's usually about anywhere between 20 and 40 minutes. Then you usually do about 20 minutes to 30 minutes of wake time, right? And then it's right back to nap time. And that is pretty much your consistency for the first like 6 weeks or so. All right, Rachel and Stephen, if expressing milk prior to delivery, are we losing the colostrum? Is more produced after delivery for the baby? 100%. You're not going to be able to express much milk prior to the delivery of your baby. So really, the Mother Nature's sort of process is for you to start making milk after the delivery of your baby. So you'll get a little bit of colostrum, but I tell parents you don't have to express milk prior. Really, the expressing breast milk happens after the baby's born. But excellent question. Is a breast crawl necessary, or is it okay to put the baby right to the nipple? Great question, Christina. It is 100% okay to put the baby right to the nipple. What resources do I recommend for sleep training? There it is. I just told you. A great book on becoming baby wise. There's another one called Secrets of the Baby Whisperer. I love both of those books. The principles are very similar. There are also nurses that are trained in sleep training. You can ask your pediatrician if they know of any, and sometimes they will come to your home for a fee and they will help your baby to sleep train. So those are great options. Okay, Natasha, if colostrum is not enough to keep baby full and it takes days to get the milk to come out, then what do you do in the meantime to help keep baby happy? So this is what I did. In the first week before my milk supply was really well established, what I did, because I had my 3 boys were like ravenous. I would breastfeed, full feeding, one side, burp, then the other side. If I still saw hunger cues, what I did, and I really wanted to breastfeed, I would give baby like 5 cc's, like a quarter to a half of an ounce, even of formula, just a little bit to kind of fill their tiny little tummies. And that worked really well for me. Now, listen, there are people from La Leche League who are really like adamant, no formula whatsoever. You're going to get lots of different opinions. I'm telling you what worked for me. You could, instead of formula, express some breast milk if you can. If you can't express breast milk, formula is your other option. So for me, just a little bit of breast milk or formula will sometimes help to fill their tummy after you've tried nursing. I think it's a really great option. And then really after a week, I didn't need formula again, really until they were like a year old. So, and then we switched them like right to milk. So it's a great option. Okay. Amy and Robert, how common is it to pump before baby arrives? Not at all, not necessary. I've heard some women start to collect colostrum in the weeks leading up to delivery. You know, Is it possible? Yes, some people have enough colostrum and you could store it up in small amounts. But is it necessary? It's not. I'm telling you that once you have your baby, if you put the baby to the breast, like I'm telling you, every 2 to 2.5 hours, Mother Nature makes a system that usually works. And if it doesn't work, then there's other options to feed your baby. But almost oftentimes, if you start that nursing within the first hour, and then you feed every 2 to 2.5 hours, you're going to produce enough milk for your baby. Also, what experience do I have with mothers using Hakas or similar products to catch the letdown while nursing on the other side? Yeah, I actually did that. So I used a shield, right? I would nurse the baby on one side because when you nurse, a lot of times the other one starts to leak. So I did that as well. I use a product on the other side that catches the milk that comes out while you're nursing the baby on the previous side, and I would save that. So it just looks like a tiny little round dome that you put over the breast inside your bra while the baby's nursing on one side. You simply take it away from the breast, and I would store what was in that little dome. I'd put it in a little bag and I would put that in the freezer and I would store it. Could you use that, put that in the bottle and feed it to your baby? Sure, you can. But then I would just put my baby on the other breast and try to get a feeding. And so, yes, I did absolutely do that. And I think it's a great way to, start to build up a little bit of a supply that you can keep for either, express breast milk feedings or stored for later bottle feedings. Is it possible to overfeed during the first months, or do babies know when to stop eating? No, babies don't. It is very possible to overfeed. So you have to remember their stomachs are like the size of a kidney bean. So we don't want to feed them actually too much at all. Keep in mind, if you're breastfeeding, it's just timing. With breastfeeding, babies will usually come off when they're full. With bottles, sometimes we don't know when they're full. So we just kind of continue to feed. That's where I say, like every, 10 cc's or 15 cc's, you want to take the bottle out of the baby's mouth and burp them, and then look for the hunger cues. If their hands are going to their mouth, they probably need a little bit more. But if they're content, they're good. You don't need to continue. So it is possible to overfeed if you're bottle feeding. Breastfeeding, not so much. Okay, if I'm planning to pump and breastfeed, when is the best time to pump in between feedings? This is where it becomes a little bit hard, right? Because in the first couple of weeks, you want to be feeding every 2 to 2.5 hours. So I would wait about half hour to 45 minutes, no more than an hour, and then pump what you can, right? So you feed 15 minutes, 15 minutes. After 15 minutes of a good latch, your baby is just there pacifying. They're not really feeding anymore. So 15 minutes, right? That's 30 minutes total. Then I'd probably wait like about a half hour, 45 minutes. I try to pump a little bit more, see if I can get anything off. Then I'm going to go ahead and wait another 30, 45 minutes, and I'm going to put the baby to the breast again. That's starting the next feeding. Okay, how long do you feed before burping? If you're talking about breastfeeding, one breast you feed, that'll be 10 or 15 minutes, then you burp, then the other breast, 10 or 15 minutes, then you burp. With bottle feeding, about every 15 cc's, so half an ounce to an ounce, then you're going to burp again. Okay, did you mention breast milk storage shelf life, or was that to be found on the resource page? That's on our resource page. Okay, if you're breastfeeding, does that mean that you can't drink alcohol? So it's a great question. It's actually recommended that there's two ways to answer that. It's not recommended that you drink alcohol while you're breastfeeding. But if you drink a little bit of beer, I'm not talking like beer, right? We're not pounding the beers, but a little bit of beer. Actually, there's hops in beer, which can actually help stimulate letdown. So I tell people if they're having trouble with letdown of milk, they're not getting a great milk supply, a little bit of beer, like a quarter of a can right before you nurse, can sometimes help. But you don't want to be drinking, lots of wine, lots of beer when you're nursing. Just know that it takes about an hour for that to process your system. So if you're going to go out for like an evening and you're going to drink wine, I'd probably wait at least an hour before you feed your baby again. If you find that you are drinking alcohol and your baby seems extra sleepy, it is probably because of the alcohol. Great question. Okay, what kind of formula do you recommend that is the most clean or organic? You know, it's a hard question. A lot of patients use Carnation Good Starts. I think Honest Company makes a formula. I'm going to punt that question to to your pediatrician because depending on where you live, there's different resources available to you. Okay, can you let unvaccinated visitors touch your newborn? 100%. I'm punting that to your pediatrician because they also have different feelings based on, what the numbers are, where you live, how many active cases there are. So I would ask your pediatrician that question. If I decide to stop breastfeeding, will it hurt? No, your body adjusts pretty easily and pretty readily to when you're getting ready to wean breastfeeding. So is a process. It takes about 2 weeks to wean your baby from breastfeeding. So I would encourage you to ask your pediatrician the right way to wean if you're going to start breastfeeding so that you don't get engorged. Which is better, Similac or Enfamil? Actually, both are considered interchangeable. It completely depends on your baby. One of my babies would vomit all the time with Enfamil and only drank Similac. My other kids did fine with either one. I could interchange them. Okay. How do you massage newborns? Yes, you can. Newborns love to be massaged. There's some great YouTube videos on infant massage, and you can do that daily. You can actually do it daily. They love it. Do I recommend the use of postnatal vitamins for breastfeeding? Yes. If you're breastfeeding, you are going to continue prenatal vitamins for the entire length of time that you're breastfeeding. Okay. Do I recommend getting colostrum before birth? We talked about that. All right, guys. So we are winding down. This is definitely home stretch. Let's take a 10-minute break, and then we're going to come back and talk about infant care and CPR and choking, and then we are going to finish up. All right. So 10 minutes. It's where I live. It's 6:40. Let's come back at 6:50 my time. Adjust for your time zone. I'll see you in 10 minutes.